Heidi.
And I'm Tracy Turner.
And this is a presentation for EDS 522 at the University of Kentucky.
We chose to present on Prader-Willi Syndrome and hope that you will learn a lot about PWS and take something from this presentation.
We look forward to hearing your comments on PWS.
What is Prader-Willi Syndrome? Prader-Willi Syndrome, also known as PWS, is the most common known genetic cause of life-threatening obesity in children. PWS is caused by a lack of active genetic material in chromosome 15. Prader-Willi syndrome is often misdiagnosed as Down syndrome simply because of the relative frequency of Down syndrome compared to PWS.
Prader-Willi syndrome is associated with the following characteristics: low muscle tone, short stature, incomplete sexual development, cognitive disabilities, problem behaviors, and a chronic feeling of hunger that can lead to excessive eating and life-threatening obesity.
In a very small percentage of cases, 2% or less, a genetic mutation that does not affect the parent is passed on to the child. In these families, more than one child may be affected.
All families with a child already diagnosed with PWS should see a genetic counselor so they can understand their chances of having another child diagnosed with PWS. It is estimated that 1 in 12,000 to 1 in 15,000 people are diagnosed with PWS.
It occurs in males and females equally and in all races.
Prader-Willi syndrome is one of the most commonly seen conditions seen in genetic clinics,
as well as the most common genetic cause of obesity.
People with PWS have a flaw in the hypothalamus part of their brain, which normally registers feelings of hunger and being satisfied.
No appetite suppressant has been proven to work consistently for people with Prader-Willi syndrome.
In many cases, a low-calorie diet for individuals with PWS needs to be implemented so that they have very limited access to food.
Most individuals must have their environment designed so that they have very limited access to food. For example, many families have to lock the kitchen or the cabinets and refrigerator. As adults, most affected individuals can control their weight best in a group home designed specifically for people with PWS, where food access can be restricted without interfering with the rights of those who don't need such restrictions.
Prader-Willi syndrome is first assessed clinically and then confirmed by specialized genetic testing on a blood sample.
Early diagnosis of PWS allows for early intervention.
Such genetic testing will detect over 97% of PWS patients.
Methylation-specific testing is important to confirm the diagnosis of PWS in all individuals, but especially those who are too young to manifest sufficient features. Following are clinical features and signs of Prader-Willi syndrome. In utero, reduced fetal movement and frequent abnormal fetal position.
At birth, often breech or cesarean births, lethargy, hypotonia, feeding difficulties, difficulties establishing respiration, and hypogonadism.
In infancy, those affected with PWS can have continued feeding difficulties and failure to thrive.
They also experience delayed milestones and intellectual delay,
as well as excessive sleeping,
strabismus,
and scoliosis.
In childhood, speech delay,
poor physical coordination,
overeating from ages 2 to 4,
and excessive weight gain.
In adolescence, delayed puberty,
short stature,
obesity,
and extreme flexibility.
In adulthood, both males and females experience infertility,
hypogonadism,
sparse pubic hair,
obesity,
hypotonia,
learning disabilities, as well as borderline intellectual functioning.
They're prone to diabetes,
and they are extremely flexible. The general physical appearance of adults includes the following characteristics:
prominent nasal bridge,
small hands and feet,
soft skin, which is easily bruised,
excess fat, especially in the central portion of the body,
high, narrow forehead,
and almond-shaped eyes with thin, downturned lips,
light skin and hair relative to other family members,
a lack of complete sexual development,
frequent skin picking,
stria,
and delayed motor development.
Thank you so much for watching our presentation on Prader-Willi syndrome.
The following pictures are of individuals with Prader-Willi syndrome, as well as our reference pages. Enjoy!